Everyone, this is Bill Keegan, Town Manager in Foxboro, with your daily update of the COVID-19 impact here in Foxboro. Wanted to just to let you know that I'm back in the office this morning, working live from the office, and the latest updates on where we are. Let's take a look at the numbers where they are as they stand today. There are a total of 44 cases that have been identified since March 15th. As being positive in Foxboro since the start of the epidemic, and total of 18 people have recovered, and as of right now there are 26 individuals that have tested positive that are currently being tracked here in Foxboro. As of right now, there are two people that have been hospitalized as a result. One remains hospitalized. I checked on the status of that person today. The person is still in the hospital, though is actually doing fine. Hopefully that person will recover soon and be discharged soon as well. There are a total of 302 people that have tested negative since the start of the coronavirus here in Foxboro, and which is good news. And again, right now, only 44 people out of the 348 that have been tested have turned out to be positive that we know of as of this moment. So let's take a look at what's happening statewide, and it's actually a much bigger story when we get to that level. And it turns out that we currently have 25,475 cases that are considered to be positive that are right now being tracked excuse me, by the state. 756 people have died as a result of the coronavirus, and in Norfolk County alone, there are 2,649 cases as of 4 o'clock yesterday. So that is the latest information that we have. Those numbers have not changed since my last broadcast last night at 7 o'clock. Yesterday, we broadcasted a little bit later due to the holiday that was celebrated yesterday on Easter, and of course Passover for those of the Jewish faith. So we're looking at 250 total cases, total states of emergency throughout the Commonwealth. A total of 8.8% of the cases have been hospitalized, which is actually, it translates into about 2,200 people are currently being hospitalized. 6,500 people are not hospitalized, and 16,800 people are currently being investigated, and no determination yet on their status. So, of the greatest impact to the age group, the age group of 50 to 59 is the greatest area being affected. That has not changed over the past 2 weeks now. 4,700 individuals are actually being impacted in that age group, particularly at this time. So we just want to keep you updated on that situation. The other two remaining areas are actually 30 to 39 and 40 to 49. Both are tracking in the area of 3,800 cases in each category. That closely aligned with the 50 to 59 group, as well as the 60 to 69 group, which is coming in at 3.6 thousand or 3,600 individuals. So let's take a look at what's happening with the latest report that's being offered for today. On Saturday, Governor Baker visited the Battle N95 mass decontamination site, which decontaminates 80,000 masks a day to help Massachusetts hospitals. Drive-through testing at Gillette for first responders will be closed today due to the forecasted inclement weather. We're also starting to experience that here in Foxboro with the high level of wind and a lot of rain. On Sunday, the state released an update on the distribution of 1,935,010 pieces of personal protective equipment. The chart is actually found on www.gov.doc/DOC/PPE distribution summary, and stated April 12th, 2020. There are many things that you can do to help protect yourself and others from becoming infected from COVID-19. People who show no symptoms of illness may still be able to spread COVID-19. A face covering may help prevent you from spreading the COVID-19 to other people. Face covering can include anything that covers your nose and mouth, including dust masks, scarves, and bandanas. Do not use healthcare worker masks such as N95 masks. Those should be preserved for healthcare workers specifically. It is important that you wear these face coverings or masks in situations where it is difficult to maintain a social distance of 6 feet or others from others. For example, in a pharmacy or grocery store, where when you wear a mask, it should fit snugly but comfortably against the side of your face. Be secured with ties or ear loops. Include multiple layers of fabric. Allow for breathing without restriction, and be able to be laundered and machine dried without damaging without damage or change to the shape of the material. When putting on and taking off a mask, do not touch the front of it. You should only handle the ties or ear straps, and make sure you wash the cloth mask regularly. Wash your hands or use hand sanitizer after touching the mask. Cloth masks should not be placed on young children under the age of 2. Anyone who has trouble breathing or is unconscious, incapacitated, or otherwise unable to remove the mask without assistance. Instructions on how to make your own mask are available at the CDC website, cdc.gov. In addition to wearing a cloth mask, you should continue to practice proven methods to protect yourself. Practice social distancing at all times by remaining 6 feet away from others when you have to leave your home for essential trips. Stay home if you are sick and avoiding close contact with others. Wash your hands often with soap and water for at least 20 seconds, or using alcohol-based hand gel with at least 60% alcohol if soap and water are not available. Avoid touching your eyes, nose, and mouth. Clean things that are frequently touched, like doorknobs or countertops. It should be cleaned on a regular basis with household cleaning spray or wipes. And cover your mouth when you cough or sneeze, or a tissue or your inner elbow, not your hands. COVID-19 food assistance is available through the Department of Transitional Assistance. DTA assists and empowers low-income individuals and families to meet their basic needs, improve their quality of life, and achieve long-term economic self-sufficiency. Women and Infants and Children Nutrition Program, otherwise known as the WIC program, is a nutrition program that provides healthy foods, nutrition, education, breastfeeding support, and referrals to healthcare and other services. It's free of charge to Massachusetts families who qualify. And the Foxboro Board of Health has links to state resources. If you or your family need help during this difficult time, you can visit foxboro.ma.gov/departments/health/COVID-19 health and get help and resources. Topics include food assistance, emotional health, unemployment, and abuse and neglect neglect resources as well. So we are at a point now where we are looking at a situation today where we have really high weather affecting the community. With high winds, a lot of rain. We're dealing with a situation now where we have the potential for a power loss today. So we strongly encourage folks to remain calm throughout this situation. The good news is that the weather remains good and warm in terms in that respect. It won't be cold. It won't be an impact in that regard to anybody who's affected by the power outage. National Grid is available and has notified us that they will be assisting us in addressing situations as they occur. The one challenge they will be faced with, of course, is the fact that they will be looking at an impact on in a situation where if the wind remains above 35 or higher, it will certainly impact their ability to get back up and to address power outages on lines, etc. So they cannot do that with the winds higher than 35 miles an hour. So that appears to be the case. Will be the case tonight between the hours of 3 to 10. So we ask for your patience. If you do sustain an impact on your power needs, certainly you can go to National Grid and report it through National Grid. We encourage you to use that resource because that will be the one that will get you the greatest amount of impact to address that. There also is and we do encourage people to actually go to download the National Grid application, which you can be added onto your Android or iPhone. The actual application is actually works like this. It is you can see that the application is on my phone currently. If you click it on, it comes on, and it'll show you the outage maps and the report outage. Or you can report an outage actually through the app itself. So if that in fact if that is in fact a useful tool that you can use during these kinds of events, and so that will help you get your power back on sooner rather than later. So I just wanted to use that that was recommended that we put that out this morning, so we're pretty pleased to be able to do that. But it is something that we carry around here, and we report information. That's how we get our information, and it shows you a map as to where the outages are occurring, and also the end gives you an indication when the power may be back up. So it's important that you have that information available to you as well. And then earlier this morning, we met with our COVID-19 task force. There were 1,000 people that right now it was reported to us this morning there were 1,000 people have been tested up at Gillette. That site is closed for today due to the weather conditions. But the test results up there are coming back between 12 and 24 hours. And up at that site, they were testing police, fire, first responders, and grocery workers were actually starting to be tested up there as of this weekend as well. So we also can report that we right now we're always looking for updates in terms of how things that are needed in the community. And we found that we still have quite a bit of toilet paper that was donated to the town. We're going to be distributing more of that tomorrow from the Council on Aging site. And so if anybody needs that, we do have several rolls still available. So if you're running short, certainly that can be available free of charge for those who need it the most. And we're pleased to report that all of our operations are fully running and operational at this point in time. For police and fire on the public safety side, we certainly remain limited, and most people working remotely here at Town Hall and in many of the other remote locations as well. And then I think that actually limits my report today. As I indicated last night, that the report today would be similar to what what I was able to report last night at 7 o'clock. And again, just a reminder of what the numbers are for Foxboro, so in case you missed them from the beginning. The Foxboro numbers look like we currently have 26 cases that are being followed here in town. We've had, since the beginning of the COVID impact, on March 15th, we've had 44 positive cases tested here in Foxboro. 18 cases have occurred that are currently totally recovered, and 302 have tested negative based on the current numbers that we've had. So we're pleased to be able to report that. There was one other person that's been hospitalized. That person is still in the hospital and recovering, and hopefully going to continue to do well and see that person out soon. So that is the latest information that we have. I'll be back with you tomorrow morning at 10 a.m. with the latest information from Foxboro. I hope you continue to stay healthy and safe particularly during the next several hours. We're told that the impact of the storm will be the greatest during the hours of the hours of 3 and 10 this afternoon and into tonight. So we certainly will be experiencing some high winds and some possible power outages. But we are working closely with National Grid, with our public safety and DPW crews, and we'll be doing the best we can to try and keep you as safe as possible during that scenario. So Tristan just sent me a text that no, it's not 26% in Foxborough. There's a total number of cases are Actually, the total number of cases in Foxborough is 26 that have been known, that we're currently tracking as cases here in Foxborough. A total of 26 in total that we're currently tracking as individuals infected with COVID-19 at this time. All right, so that does it for today. I will be back tomorrow morning for more information on what's going on in Foxborough. If you have information or something that you'd like to get from me from the town, you can send me an email at wkeegan at foxboroma.gov. Until then, I'll see you next time.